Today, our hearts are wrapped in pink. October to some, it's just not a month. It is a global reminder of breast cancer awareness. And who better to take us through that than a reproductive specialist who has just joined us in studio today. Welcome to Amaika Live. I'm your host, Faith Shikanga. Hello, good morning.
Good morning.
Uko salama?
Niko salama, nashukuru.
Okay, hata sisi tunashukuru sana kwa kukuja. You can just introduce yourself to our lovely viewers beyond even the medical banner.
Hi everyone. I'm Mildred Ahonya. I'm a nurse, a midwife, a passionate midwife. I've specialized in reproductive health, where we deal with matters, reproductive health, health of the mothers, health of the babies, and all reproductive health matters. Today we are here to talk about breast cancer. And October is our breast cancer month, our pink month. It's a month that is really needs to do much with the breast cancer. There are survivors out there. There are people who need hope out there. And it will be very nice to hear about breast cancer and what you can do in your position to assist anybody with breast cancer.
Nice. Now, first thing is first, something that everyone always wants to know. How can you detect that somebody is developing breast cancer? That one thing that most of the people normally overlook.
Great. Before you know how to know that you have breast cancer, breast cancer is integrated together with the cervical cancer. And so the mainstream of this is the screening. The screening is done in the facilities and you are taught how to do the self-breast exam at home. So that whenever you detect anything that is not normal, you are able to move forward and get assistance from the facilities near you.
Nice. You know, you've just mentioned of doing an examination of your own, and that is where most of the people tend to get it wrong. So I just want you to take us through a proper self-examination.
Before we go to the proper self-examination, we really need to understand the burden of breast cancer. Why are we focusing on breast cancer per se? And globally, you realize that breast cancer is ranked at the top, among the top cancers in the whole world, which is about 11.6% of all the new cases. And then in Kenya, it's a leading overall cancer incidence with a rising percentage. And it's the second leading cause of maternal death in the cancers that affect the women in Kenya. Yes. So once you understand that, then you need also to understand the facts about the breast cancer, that it is associated with good prognosis if you are screened early. If you are screened early and the detection is done early in good time, the prognosis is good. What do I mean by prognosis? You are able to come up with a good end result from it. And then 25% of women are aged between 15 and 49 years. Those are the women in reproductive age. Then before you do that screening, when are you supposed to do this screening for you to get the right results? You don't just wake up any day and you start doing the screening. The screening needs to be done at least 1 week after the menstrual period. Because during the menstrual period, there are changes in the woman's body, the hormonal changes that may affect and may result into something different. That when you are examining, you come up with the results that may really frighten you, yet you have not done the test at the right time. Yes.
Yeah.
And
if you can just take us through, of course, the self-examination. And another thing, you can just start us off by distinguishing, because normally the common thing is normally to check your lump. So how can one distinguish between a normal lump and a lump that might be suspicious or even cancerous?
What I would say, once you do a self-exam and get up with a lump, anything that is not normal, we are not only focusing at the lump, and that's why we are saying early screening is the best. So when you are doing a self breast exam, you need to start by inspection. We have what we call inspection, then we have the palpation, and then we have the other tests that will follow. So when you are doing inspection using your arms, you take your arms up until you get up. So as you are moving your arms, you are observing the movement of the breasts. When they move together, that is good. But when you realize that one breast is moving, as you move the arms, maybe one breast is moving and the other breast remains down, that's already a sign that needs to worry you. And then after inspection, are they equal in size? Are they symmetrical? How is the nipple? How is the nipple position? Is there any dimpling? You see, there are things that you will detect just by inspection. Then after that is when now you move to the palpation. And now how is the palpation done? For the palpation with your hand behind your neck, you now you now palpate. So you use the right hand to palpate the left breast. And then you will use your left hand to palpate the right breast. So when you are doing the right breast, you use the pads of the fingers, the 3 pads of the fingers. Then you move without lifting the hand. So you move simultaneously. And as you move, when you get to if you feel any lump, this lump may be painless, it does not move, it could be painless and stagnant at one place. Then after that, you press the nipple. For mothers who are breastfeeding, we don't even want to contaminate that breast. They are examined during the antenatal period and even during the breastfeeding. In case of any problem, they are able to detect that problem. But for those who are not breastfeeding, so for the breastfeeding mother, you expect when they press the nipple to come up with some breast milk. But for these other people, when you are palpating the breast, you may need to see just some little fluid. But in case you see anything like pus, blood, or anything that is not normal, then that is something to worry you and you need to move to the nearest facility just to confirm what you are suspecting.
Yeah, and you've just left us at a very good point. Once somebody has detected an abnormality with the lump or even some kind of discharge from the breast, what next? What is that next test that this particular person has to carry?
Thank you for that. What I will say, after you have inspected and seen any abnormality, you move to the facility. Even the primary level facilities have staffs who are able to detect in case you have anything, and then they refer the clients to the referral hospital, where our county referral hospital is Kakamega. And when they are referred there, from there we have a breast specialist. And these clinics run every Wednesday. So that at that time, they are able to detect, is this client worth doing an ultrasound? Is this client worth doing a mammogram? It depends with the age. So for the self-breast exam, it's done by every woman. Those who are in reproductive age. Remember I mentioned 15 years to 49 years. After that, for those who are 35 years and above, these ones are now supposed to do a mammogram. I don't know how many times we just walk in the facility. You are not sick, but you just go to the facility. Sister, today I've come just to check my breast. Yeah, that is where you detect where this person desires to do an ultrasound, a mammogram, or a clinical exam will do.
So the type of test is kind of based on age. It's a factor?
Yes, it is based on the age.
Okay.
Yes.
Wow. And one thing that most of the people always want to know is that just because I have a family member who has cancer, does that mean that the risk kind of spirals up? Is it hereditary?
Good. And that brings me to the causes of breast cancer and the risk factors. The risk factors. What will predispose you to the breast cancer? The causes of breast cancer have not been understood up to now, but there are several factors that raise the risk to develop the breast cancer, and these risk factors are divided into two. We have the modifiable risk factors and the non-modifiable risk factors. The modifiable risk factors, they are those factors that can be controlled. They are things that an individual can control. The non-modifiable risk factors, you have little you can do about them. They are there with the body. So when we talk about the modifiable risk factors, I said they are the factors that can be controlled, that someone can be able to control. So when you are talking, we start with the uncontrollable, non-modifiable risk factors. These are factors like the age. You know, when you are 18 years, you can't return yourself to be 15 years. When you are 40 years, you can't reduce your age. That's why we call it unmodifiable. So the incidence increases with the age. As the age moves, the incidence increases. And that's why we recommend that everybody who is above 35 years, walk into the facility, just do the screening. Then you can do a mammogram, you can do an ultrasound. Yes, that one will be able, screening is key in this. Then after the age, we have the gender. Yes, we have seen men who have been affected by the breast, the breast cancer, but the incidence is much higher in females than in males. When we talk of genetic factors, you realize that 5 to 10% of cases are hereditary. It could be there's someone in the family, the family history, when I talk of genetics. So what do we do when we have such people? The only thing is screening, as we say. So once there is that history, you move into do screening. Then early menarche. What do we mean by early menarche? Those people who started their menses earlier, at an earlier age, maybe below 12 years. There are those girls who start by 9 years. Early menarche could also predispose these girls to the same breast cancer. And then the family history of any type of cancer. If there is any type of cancer in the family, you need to screen regularly so that you are able to detect it early in case it is there. And as I said, there is proper prognosis if it is detected early. Then we have the late menopause. After 55 years of age, they are also at risk. Especially those who go in for hormonal replacement therapy. What do I mean by hormonal replacement therapy? They are in the menopause. Menopause comes with its challenges, the hot flashes, the mood swings. Then someone feels she doesn't want to experience this. So you go in for hormonal replacement therapy. This hormonal replacement therapy also predisposes one to the breast cancer because it is majorly estrogen. Then exposure to radiation. Exposure to radiation, there are those, you get something small, you want to do an x-ray. There.
That is so me.
Yes. Then you have a client, you take them frequently for the x-rays, you get in the room with them, you are exposed to those radiations, then you are also at risk. We also have these people who have no children at all. They are also at risk. The incidence decreases when they give birth. It's because of the hormonal changes during pregnancy. Is different from the hormonal changes for these people who have never given birth. Giving birth at an older age, the elderly primee, after 35 years, primigravida is someone who has never given birth. So you are getting your first pregnancy at an older age, 35 years and above. This also places you at risk. Not breastfeeding at all. There are those hormonal changes that take place when you are breastfeeding. So for those who are not breastfeeding at all, they are also at risk, at higher risk than the others. Then eating lots of processed food,
Nice.
the fatty food. It also places them at risk, and then lack of exercises and obesity.
Okay.
Yes. So among the factors I've talked about, there are those that you can control and there are those that you cannot control.
Very clearly put. Now, if I can just take you back, I would just want to know maybe some of the signs, apart from the usual lump checking, that might show that you know, suspicious signs that you might have breast cancer.
Thank you so much. So, as we did the breast exam, there are things to look for. So when you look for changes in the skin textures, when you are doing that breast exam and you see there is a puckering, dimpling, you understand the dimples. So when you see a breast that is dimpling, that's also a sign. That's a warning sign that you need. Once you see that, you need to move forward.
Nice.
Then feeling for lumps and thickening. You could be having a lump just thickness that is hard. When you press the breast, you find it is hard, thick. That is something you need to look for when you are doing the breast exam. Nipple discharge.
Yeah, that is what I wanted to get it.
Nipple discharge. For those who are breastfeeding, we said breast milk is normal. But if you are not breastfeeding and you see the discharge that is maybe pus, bloody, anything that is not...
And the color of the discharge?
Any discharge that comes out, it's a sign that you need to move to the facility so that it is confirmed.
Okay.
Yes.
Now we... Just go ahead.
Nipple inversion. The nipple is supposed to be out. Sorry, I didn't carry my breast, but next time I think I'll show you. So this nipple needs to be out, but when it is retracted, inverted, and change in direction, instead of facing the front, it faces sideways, inverted. That is something that really needs to be checked. There are many things you can look at in the breast, and they make you to move forward for clarification.
Okay.
Feeling of pain in your breast or in the armpit. You know,
it goes beyond the breast.
Yes, the lymph nodes.
Yeah.
When you feel some pain in the armpits, you also need to move forward for clarification. Nice. Changes in shape and size, I've already talked about that. Or a rash. Just a rash that appears in the...
Around the nipple?
Yes, around the nipple or the surrounding area in the nipple.
Now, we all know it's good to protect than actually cure it. So I just want to know maybe what lifestyle changes can one try to kind of practice so that he or she can prevent the risk of acquiring this disease.
Good. And that is what we call the prevention. Prevention, we have the primary prevention, which we have said, screening.
Yeah.
So even before you go for this screening, exercising, regular exercises,
please,
is good. And then maintaining a healthy diet, and then limiting alcohol intake. Those three. Exercise, healthy diet, limiting alcohol intake.
Limiting alcohol intake. I don't know why I feel the need to emphasize that.
Yes, limiting the alcohol intake may predispose you to the risk factors. Yeah, because of the what is found in alcohol. Yes, even the smoking. You know, there are ladies who smoke.
Yeah. Now, if we can just shift now to the treatment. First of all, I would just want to know, is it necessary to do away with the affected breast? Or the tumor can just be removed without necessarily tampering with the breast? Because if you ask me, most of the women, after the breast has been removed, they feel it is stripping them of their womanhood.
Yeah, it's quite devastating. And what you will say, once you get these signs, after the clinical breast exam, there's something that is called imaging. Imaging is whereby you do an ultrasound or a mammogram. From this ultrasound and mammogram, you now get to decide what you want to do. Then if there are these signs, you need to do a biopsy, core needle biopsy. This biopsy will now determine if it is a cancerous or a non-cancerous. Yeah, there are lumps that are not cancerous in the breast. That's why I said, once you get it, it's always good to go forward for confirmation. So after the biopsy, now it will determine the kind of treatment that will need to be done. We have several stages. It is staged. So once the staging is done is when now you move to the treatment. Treatment may include surgery, it may include chemotherapy, radiotherapy, or other hormonal therapy. Others like the hormonal therapy. So it will depend with which stage the cancer is. And I wouldn't wish anybody to wait to get to a stage. Just go for early screening and it will be able to save a life.
When early screening is done, I'm just still going back to the question that I asked earlier. Once it's detected earlier, can the removal of an entire breast be, avoided once an early detection is done?
Yes, once an early detection is done, hormonal therapy, the chemotherapy and radio can be done. But what happens with most women, we go when it is too late. So if it has not metastasized, metastasis means the cancer has spread to the nearing organs, the neighboring organs. We have the chest, we have the lungs. So removing this breast will save this cancer from spreading to other organs in the body. And it will be one way to manage this client, depending on the stage that it has gone.
Okay.
Yes.
Now, still on that, I would maybe if I can just know, do we have any surgery or any surgical that can be done to kind of restore, once a breast has been removed, to restore the initial outer look of the breast?
Ah, great. What we normally do, once the surgery, the breast has been removed, what is done, they are given prosthesis. I told you I forgot my dress. Eh?
Yeah, you did.
Yeah, there are things that are made to look exactly like the breast. So when this client has been removed, the surgery has been done and maybe one breast has been removed, that prosthesis is put on and it looks exactly like the breast.
Okay.
Yes.
Now, when going through, either maybe somebody is going through chemo or any therapy, what are some of these challenges or adverse effects that are expected?
There are several
during the
adverse
treatment
effects during chemotherapy, and this, when this drug is going in the body, it is going to destroy the abnormal cells. The cancer is the growth of the abnormal cells. So when they are doing this chemotherapy, it goes in and at times it destroys the good cells and the bad cells. You find that this client now has hair loss.
Yeah.
The hair disappears from the head. There is nausea, there is vomiting. The person is very weak at times. Before they come up again, they become very weak, lethargic. It's because of the side effects now of the treatment. But the good thing is, once they are cancelled, they are normally cancelled before this treatment. Once the client is cancelled, she's able to cope up with the treatment because you realize, even if I lose my hair, but I'm saving my life, this hair will one day grow after the treatment. So once the client gets to that, then they are able to cope with the treatment. But it is not the best if you are not cancelled properly. And the surgery varies. There is the complete, where they remove the breast plus the mama, the glands in the axillary, or they just remove part. It depends with how far the metastasis has gone.
Once the treatment is done, can one restore his initial look?
Yes, there are several people who have restored their initial look. The only thing that now the breasts, if it was removed, you now have to put on a prosthesis, and once cancelled, they cope up with it and they are able to move with it and continue with life.
Now, you've emphasized so much on detection of it and early screening.
Yes.
Once it's detected early, this is a question that everyone will always want to know. In fact, I just want you to target to our viewers. Can one be completely cured of cancer once it's detected early?
Yes, if detected early during the screening, once you get this lump at an early stage, it is normally just the lump that is removed. And if it is non-cancerous, there is no spreading. Yeah, if it is detected early, prognosis is very good.
Okay.
So I would urge each and everyone. It may be your sister, it may be your mother. Let us encourage each other to go for this early screening, because once it is screened, you will not wait until the late stage where the breast is going to be removed after the metastasis, after the spread of the cancer.
Now, the most common medical cover, SHA, do you think that the money allocated to those patients is sufficient to take care of what an actual cancer patient has to go through in terms of treatment? The money that is being allocated, because we saw cancer patients somewhere last month, they demonstrated claiming that that money is insufficient.
Yeah, what I will say, the SHA for the primary healthcare facilities, all the services are catered for in the SHA. But when you move to the higher levels of the facilities, it caters for majorly the treatment. So let us try to do the primary prevention by going for screening, because in this screening in the primary healthcare facilities, it is catered for. For the treatment, it's also catered for in the treatment of the cancer. Yes.
Now, to our viewers, if you've just joined us, we are being joined by Dr. Mildred, who is taking us through just, breast cancer. What are some of these myths that are being associated with? And most importantly, how can we prevent it? Of course, it's by early screening and early detection. Now, if I can just go back to Kakamega County, do we have any special groups or perhaps any counseling services that are being offered to cancer patients as a county?
Oh yes. In our rural facilities, all the rural facilities have staffs who have gone through the basic training. They are able to counsel and health educate these clients on cancer. Not only breast cancer, as I told you, we integrate breast and the cervical cancer.
Yeah.
And then the referral hospital, we have a cancer center. And in this cancer center, the clients who have now passed the primary, they have now gotten to treatment. We have the palliative care, we have the counseling services there, and chemotherapy, radiotherapy, counseling is done to these clients, and then they are put into social groups. So that when you are talking to somebody who has gone through the same problem as you, and you are able to hear from this person how she survived all the stages and she has been able to heal, you get the strength to move on. You get the strength to know that one day I'll be there. So we have all this in the referral hospital at the cancer center. Yes.
And the patients, because I know you've interacted with them in their setting of a group, are they free to tell the new patients who are coming in what they normally go through? Are most of them really free to just bring out their story?
It's not easy, but once they have gone through the counseling, And if you wish, maybe we can get one survivor.
Sure, by
There
all
are
means.
survivors who have moved and they have come and talked how they went through. It is quite traumatic to them, but they have moved through it and they are able to encourage someone. So that one day we can bring a survivor who can talk to our viewers to see how they have moved through, how they have been walked through the process and up to the time that they have recovered.
Yeah. And the best term I would call the survivors, they are our warriors.
Yes.
Because going through such, it might be really, really something that is giving them a lot of stress, but to us, you're really our warriors. And this being a month, we do celebrate you. Even as we wrap up, maybe I would just want to know, what are the odds of breast cancer coming back? Once somebody, the odds, once somebody is completely healed, are there chances of you having cancer?
Or recurrence.
Yeah, recurrence of cancer.
This will depend with the adherence. You see, if once a warrior, let me call them warriors,
they
have really
fought
this war and they have come up successfully.
True.
Once with the counseling and they are able to go through the treatment, we have very few recurrences. But what happens is adherence, lack of adherence. These people need family support. They need the social support. They need the financial support. Even if the SHA would cater for all the treatment, they need to be moved from the home to the facility. And once these parameters are missing, the client may default. And that is when the recurrence could occur. Otherwise, with breast cancer, the prognosis is very good.
Okay.
Yes, the end result is very good. Few recurrences due to lack of adherence to treatment. And when it is late, when it is diagnosed late, there is not much that can be done about it.
Right. Now, once the treatment has been very successful, is there a need for one to go back for a checkup?
Sure. Yes, they need to be checked regularly. You need to do regular checkups, follow up with the doctor's calendar, because you are not just left like that. You need to be checked regularly. There is even that support that continues after the treatment. So people really need to keep the appointments and continue with the medication. There is the diet aspect, and then there is the social aspect.
Oh.
Yes.
You've been very profound with the explanations, madam, if I can say that. So maybe your final remarks to patients or anybody who is taking care of them as we wrap up.
Breast cancer is one of the leading cancer in Kenya, in women. And for those who take care of these clients, they are clients who really need a lot of support. In the facilities, the healthcare providers need to really integrate the breast cancer in all the services. When they are coming for this cervical screening, we need to integrate with the breast cancer. In the antenatal care, they need to check these women and integrate the breast care. Then educating the community. It may not be you, it may be someone, but you have something to do about the community, educating them to perform the self-breast exam. It is something that is very simple, but it's a high-impact intervention, because by doing this self-breast exam, you are able to detect something that could have gone a long way to destroy the cells. Then conducting annual clinical breast exams. As much as we are doing the self-breast exam, once in a year, you need to move to the facility, to a healthcare provider, and just be examined clinically. Then after that, all the women above 35 years need to be referred for ultrasound, mammogram, which will detect if there is any problem. Then if there is any suspicious breast lesions, we need to refer them to the specialist.
Nice. Thank you so much for honoring this invite. I really do appreciate you. I cannot thank you enough. I don't know about you viewers, but for me, I just feel like I covered a unit in medical school of cancer, and I hope the same applies to our lovely viewers. This has been Amaika Live. I've been your host, Faith Shikanga, and a big thank you for always tuning in. Asante sana kwa kukuja.
Asante.
Okay.
Thank you.